Before we continue on the pathogenic bacteria, we should also remember that not all microbes are pathogenic. In fact, a lot of microbes are actually helpful and are good for our health. And they are naturally present on the skin and mucous membranes of healthy normal persons. We call these normal human microbiota or normal flora of the body. In other words, they are the good bacteria. So microbiota can either be resident microbiota, which consist of relatively fixed types of microorganisms that are regularly found in a given area at a given age, and if they are disturbed, they promptly reestablish themselves. Or they can also be transient microbiota, which are non-pathogenic or potentially pathogenic microbes that inhabit body sites for hours, days, or weeks only. These transient microbes are derived from the environment and does not produce disease, but they do not establish themselves permanently in the body. Now, if transient microbiota are disturbed, it is generally relatively safe for as long as the normal resident flora remain intact. The problem is actually when the resident flora are disturbed and the transient flora may proliferate and produce disease. So what are the functions of normal flora? These are only some, okay, in general. So they provide the first line of defense against pathogens. They assist in digestion. They play a role in toxin degradation. They contribute to the maturation of our immune system. In the GIT, for example, microbes are responsible for the synthesis of vitamin K, so metabolic and protective functions, which is actually why in newborn babies where their gastrointestinal tracts have not yet been colonized with microbes, they have no microbes to synthesize vitamin K. Now we know that vitamin K is essential to prevent bleeding, right? So since they do not have microbes that synthesize vitamin K, newborns do not have vitamin K and they are prone to bleeding. So that's why we have to inject them with exogenous vitamin K right after birth. Now the only parts of our body that should not contain any microorganisms are our blood, our body fluids, and our soft tissues. So these are considered and they should remain sterile. By the way, in your textbooks, there is a table there, table 10-1. It shows a list of body cavities that are not sterile and contain normal flora. So you will also see the different good bacteria expected to be present in those areas. But let's just have a brief rundown so that we know in general what kind of bacteria are present in our body. So at its earliest stage of community development, the human microbiota is already homogeneously distributed across the body. That's actually less than 5 minutes after being delivered. Okay? So the predominant resident microorganisms of the skin are the aerobic and anaerobic diphtheroid bacilli, for example, Corynebacterium and Propionibacterium. We also have on our skin non-hemolytic aerobic and anaerobic staphylococci, such as Staphylococcus epidermidis and other coagulase-negative staphylococci. Sometimes we also have Staphylococcus aureus. And then there are many other bacilli and cocci present in the skin. We might also have fungi and yeasts. They are often present in skin folds. And you will also find acid-fast, non-pathogenic mycobacteria in areas that are rich in sebaceous secretions, for example, the genitalia or the external ear. In the respiratory tract, the flora of the nose consists of prominent Corynebacteria and Staphylococci, and also Streptococci. In the pharynx and the trachea, there's a similar flora, but a few bacteria are found in normal bronchi. The small bronchi and the alveoli, however, are normally sterile. Okay? So in the mouth, dental plaque is actually the most prevalent and the densest of human biofilms. So if you remember in our intro, Leeuwenhoek saw a lot of bacteria in dental plaque. So there are a lot, please just check your textbook. But to note, S. mutans is considered to be the dominant organism for the initiation of caries, no? Due to accumulation of acid products produced by the bacteria. So this causes it to react with teeth enamel. The intestinal tract is very rich in organisms too, except the stomach, of course. It has less because of the acidity. At birth, the intestine is sterile, but organisms are soon introduced with food. Bifidobacteria dominate the intestinal microbiota of breastfed babies. In bottle-fed babies, however, it's more of a mixed flora, and lactobacilli are less prominent. Now, there are special important functions of intestinal microbiota. So they have protective functions, where the resident bacteria displace and inhibit potential pathogens. So indirectly by competing for nutrients and receptors, and even directly by producing bacteriocins and lactic acid. So again, to prevent opportunistic bacteria from growing. So the normal flora of the intestinal tract also help in the development and maintenance of mucosal immune system. No? They induce secretion of IgA, and they influence development of the humoral system. Intestinal flora also contribute to metabolic functions. No? They contribute to the amino acid requirements of the host. We already mentioned earlier the synthesis of vitamin K. Synthesis of biotin and folate are also important, which enhance ion absorption. Now, intestinal flora are suppressed by taking antibiotics. So this may result to diarrhea, for example. And not just diarrhea, it could even be worse. Like, for example, the pseudomembranous colitis, no? This is due to opportunistic infection due to the suppression of the normal flora in the colon. Okay, and we also have vaginal microbiota. Not we, of course. The ladies have vaginal microbiota. The normal flora in their vaginas change depending on the acidity of their vagina. So they are normally host to lactobacilli, but this can be especially suppressed when they take certain antibiotics, allowing yeasts, among other infections, to cause vaginitis.